This segment of the news is brought to you by Sun Oil Limited.
Welcome back. Training is underway for National Emergency Medical Services staff preparing ahead of any possible threat of coronavirus or COVID-19. NEMS staff began personal protective equipment PPE training this week at the Public Hospitals Training Center. EMT Adrian Archer said the training provided the team information on what signs to look for in a potential patient and also gave directions through drills on personal protection specific equipment. Also gave directions through drills on personal protection specific equipment for responding to a case of COVID-19.
The training is different, whereby we have a different standard protection, but today this training is a little bit more intense because we have to know how to protect ourselves.
Now, while there are still no suspected, reported, or confirmed cases of the disease in the country, the emergency technician says frontline responders like himself and paramedics must be trained to ensure they deliver optimum care.
What we want to let the public know that, in the event that we do have a situation, that you have trained professionals, who been to class and who is able to sit and go through the different various ways to treat the patient and protect ourselves. So the public have no need to, to get a little frantic because, we're going to come there and do what we got to do as far as, taking care of that patient. And we're set up whereby we have different areas of isolation where we're going to be taking the patient. So, it's a good thing. And, like I said, it's very important that we do this type of training every year because we do need it, especially going on there and what's happening around the world now.
The training also encompasses several emergency response modules, which are being provided by the Infection Protection and Control team of PHA. NAMS training officer Laveda Adderley says while the training is directed to care given when responding to an emergency call and possible coronavirus case, it also extends to responders being able to ensure they employ safe practices to not only protect themselves, but their families.
Our director, Dr. Alvari Hanna, has ensured that she will have all of our necessary equipment needed for best health practices and safety of her crew, along with the wider public, that we will be prepared in the event there is a suspected case or a case of an infectious disease such as the COVID-19, so there's no panic. We are trained to do what we have to do, and we are prepared to go out there and do the jobs the best we can. So there's no need to panic. We will have the necessary equipment needed to get the job done.
Now, according to Ms. Adderley, the training also highlights the importance of collaboration.
The goal is to have collaboration with all entities, whether it's the police, the surveillance unit, the port, the airport surveillance, and whoever's there, Port Authority, whoever's there to liaison with us whenever there's a suspected case or there's an infectious case. Well, they're usually the ones on the forefront. We are also on the forefront, but the surveillance nurses also has to get in there to their job and then alert us about if we need to be transporting these patients. But in the event, however, all of us need to do this training, and we all need to be prepared.
Just over a month ago, the Bahamas National Plan for Coronavirus disseminated guidelines for responding to suspected coronavirus cases. Protective equipment has been deployed to NAMS staff in Grand Bahama, who will also receive training. Training will also be done by emergency department staff at the Princess Margaret Hospital and all other public health staff and facilities. Training will be going on as necessary. Stay with us. Dorino Saunders is up next with sports.
This segment of the news has been brought to you by Sun Oil Limited.